My name is Karen Kubian, and I'm a patient navigator at the Breast Cancer Resource Center in Austin, Texas. The Austin medical community has been working hard to ensure the safety of patients and staff while preparing for the expected increase of critical care needs for those with COVID-19. Because of this, there have been significant changes in treatment for those diagnosed with cancer. To help those with breast cancer in our community, we've asked, the Breast Cancer Resource Center has asked a few of our medical professional partners to shed some light on cancer care decision-making due to COVID-19. Today, I'm grateful to have Dr. Ryan Tierney, radiation oncologist from Texas Oncology. Dr. Tierney is board certified in radiation oncology by the American Board of Radiology. He received his medical degree from Washington University in St. Louis, Missouri, completed his internship training in internal medicine and residency training in radiation oncology at Barnes Jewish Hospital of Washington University in St. Louis. Dr. Tierney, thank you so much for joining me today.
Absolutely. Thanks for having me. This could be a scary time for all of us, but especially for cancer patients. So I'm happy to be able to talk about any kind of issues that may come up.
We are so grateful and really appreciate it. So let's get to some questions. So for breast cancer, generally we expect that radiation therapy, if it's needed, will come after breast surgery and any recommended chemotherapy if that's necessary. And typically the cadence is radiation would begin maybe roughly 4 weeks or so after the previous treatment. So how is COVID-19 changing these recommendations?
Yeah, prior to COVID, obviously, my philosophy was always, because we come at the end of everything, patients wanted to see it in their rearview mirror as quickly as possible and get things over sooner rather than later, obviously. But here in this time frame with COVID around, we have to think about ways that we can minimize exposure to other patients, exposure to the health system and that kind of thing. So although prior to COVID, we would start generally within about 4 weeks, fortunately for breast cancer specifically, we have a lot of really good data that shows that there's no compromise to overall cancer outcomes if we push that radiation back. And we have data that suggests actually up to 20 weeks down the line after everything, we can push radiation away and hopefully get away from this acute COVID time period that we're all in right now.
Great, and so that's really interesting. And then are any of the recommendations being shortened in terms of treatment length or number of sessions?
Yeah, fortunately, we had pretty good data from several years ago that allowed us to shorten a lot of breast cancer treatments from 6 weeks to 4 weeks, and the vast majority of our patients were already getting that, which is obviously good. There are other studies which show that different regimens can be used, and fortunately, those don't show any compromise as far as either control of the breast cancer or overall survival. So it's important for cancer patients to talk with a radiation oncologist and see if there's ways that they can shorten, or like we said before, push back the regimen for safety's sake.
Sounds great. And so for those that are receiving radiation therapy right now, are they any more susceptible to COVID-19 or potentially have more acute symptoms from COVID-19 if they come down with it?
Breast cancer specifically, usually not. Fortunately, with radiation for breast cancer, we don't cause a lot of significant change to the immune system. So I would not expect patients would be either more susceptible to COVID-19, or I would not expect if they were to unfortunately come down with the virus, the symptoms would necessarily be any worse because of radiation to the breast or to the chest wall. When we treat certain parts of the body, like the lung, for example, we could suspect that there may be more issues, but with breast cancer specifically, we really wouldn't expect that.
That's great. And is it safe to go to radiation centers right now for treatment? What are some of the things that the treatment centers or Texas Oncology are doing to protect patients and staff?
Yeah, so in this continually changing environment, we know it's important to make operational changes that we have done to support and care for our patients who do need treatment. We've done a lot of things over the last couple of weeks. We're concentrating our staff in core locations. We're temporarily altering our office hours. We're closing some satellite locations. And then we have specifically implemented some new protocols and changes to how we operate. Specifically, all of our patients, we are urging them with fever, cough, or shortness of breath to call before coming for scheduled appointments. We're screening everybody who comes into our facilities at all of the entrances to make sure that both staff, our vendors, and our patients are not experiencing any symptoms and are not having any fever before they come into the building. We're also providing information for patients who may need COVID testing. We're postponing non-urgent appointments. We're doing a lot of telemedicine appointments like we're talking today to try to minimize exposure to patients inside the facility.
Okay, great. And is there anything else that patients that are coming in for radiation therapy should do to protect themselves?
Well, obviously trying to minimize contact with others, as we're all being expected to do. Very important to talk to your physician or talk to your providers if you have any symptoms, including cough, shortness of breath, fever, any abdominal symptoms. Important to talk about those so we can think about testing if those kind of symptoms suggest that it may be necessary.
All right, terrific. Well, thank you so much for joining me today, Dr. Tierney. This has been extremely helpful.
Sure, absolutely. Thanks for having this. It's really important for us to get this information out to our cancer patients. So again, I want to thank you for doing this for them.
Thank you.